There's no scientific basis to homeopathy.
The COVID-19 pandemic actually shone a light on how important homeopaths and complementary practitioners are to this country, what a critical role they played at a time when medical practitioners were so difficult to come by in general.
Would you like to give some examples of cases where people have just left allopathy and after having severe conditions?
There's a cancer case that comes to mind, and she was asked to basically go home, and she was given weeks to live. And she's not disease free, she's still suffering, but she's now in our 4th year of treatment with us.
Wow. There's a big controversy around the fact that, there's steroids and homeopathy uses steroids. Is that?
Usually I find an emotional statement rather than a statement from a position of being well informed. Absolutely untrue. It's actually illegal for a person who has a license to practice homeopathy to prescribe steroids. But if you're looking at, say, a skin disease, that's incurable under conventional systems.
Hi everyone, welcome to No Idea Whatsoever. We have a very interesting topic today. It's on homeopathy, and for that I have Dr. Kushal Banerjee with me. Dr. Kushal is the only one in the history of the University of Oxford to have been accepted to read for a Masters of Science degree. He is highly renowned and one of the best homeopaths in the country. Please welcome him today and learn all about homeopathy. Welcome to No Idea Whatsoever.
Thank you.
It's very nice to have you here, Dr. Banerjee.
Thank you so much for having me.
Yes. My first question, is did you know what you were going to do when you grew up, or did you have no idea whatsoever?
So I think I did. We have homeopathy in the family. I'm like the 4th generation.
Okay.
So I was exposed to homeopathy pretty much from the get-go. And I always wanted to become a doctor. But that was the only kind of medicine that I was ever exposed to. Only later did I realize that this is different from conventional systems of medicine. Yes. But then I realized I can't do something that I don't practice or haven't really used myself. So which is almost like an organic progression towards homeopathy as a profession.
Okay. And so you said that you weren't exposed to any other medication. So when you were younger, the only route you had was homeopathy?
Yeah. So I have, it's weird to share my medical history, but I've had only one instance where I've needed allopathic medication in 4 decades of my life. And I don't feel that that's really an exception, but it's very, very infrequent within the family. There is a scope and limitation to every system, but the requirement has been pretty limited in my family and now my children as well.
Okay. Can you tell me a little bit more about your background in homeopathy, your father? You said it's a 4th generation, so how did it begin?
So it actually goes back further on my mother's side.
Okay.
Started with Ishwar Chandra Vidyasagar, who was a social reformer. We trace our family line up to him, and he brought homeopathy to India in the pre-independent state as a form of social work. And his nephew was my great-grandfather. So with that influence, he started his clinic in a small town called Mihijam in what is now Jharkhand, and where about 100 years ago, our first family clinic was set up. Also on my father's side, we have homeopaths as well as other doctors, and it just carries on from there.
And your father obviously became very renowned. Everyone, I remember, hearing about him even when I was younger. He was very, very well known in this.
Yes, so he set up his practice essentially in Delhi. He moved from Calcutta and Mijam to New Delhi, and he's now in his 5th decade of practice.
Wow.
And yeah.
That is quite amazing. So you have a mix of allopathy and homeopathy doctors in your family. That's very interesting. Tell me, for people listening, what is homeopathy and how is it different from allopathy?
Right. So homeopathy was discovered by Dr. Samuel Hahnemann in Germany in the 18th century, late 18th century, almost 19th century. He himself was a conventional allopathic doctor.
Okay.
But he was very disillusioned with the practices of that time, which were really backward and made no sense to him and were very unscientific for that time as well. So he realized that if a drug or a diluted version of an herb or an element is given to a healthy person, the symptoms that it gives rise in that person uh, can be treated if a patient comes with those symptoms. So, like is cured by likes, homeos. So, homeopathy. So, similar suffering is basically what it means. And that forms the indication of our materia medica, what we refer to when we look at patients. The list of symptoms that healthy people gave rise to when they consume this medicinal substance in a very controlled setting is what tells us what to prescribe in patients who have those symptoms. This was the basis. This is almost 250 years ago,
Okay.
but this was how it developed. And it's different from other systems or other herbal medicines, including Ayurveda, in the sense that there's a dilution aspect of it, which removes the side effects. So there are no crude drugs or crude elements in the medicines. So the homeopathic medicines then become free of side effects.
Okay.
So you may look at an ingredient of a homeopathic medicine and see that, oh, this is could be a toxic metal, but because it's diluted to such an extent that it actually doesn't have any of the toxicity, but whatever therapeutic powers were noticed during experimentation is all that remains.
And what is the difference between the training for a doctor who's studied homeopathy versus allopathy?
Right. So this varies depending on which part of the country this is being answered.
Okay.
We are very lucky in how well established and standardized this is in our country in India, where the training is exhaustive, I think. It's 5.5 years undergraduation and then 3 years for an MD if you so choose. And the undergraduation is structured to mimic the MBBS course
Okay.
and has all the subjects that an MBBS student may study, and removes pharmacology and adds the homeopathic materia medica and some homeopathic subjects. So there are colleges and universities, for example, where MBBS and BHMS students are studying side by side because of common lectures. They're conducting dissections on cadavers together. So it's a very high quality of training by and large in this country, and which I believe is one of the reasons why homeopathy is doing so well, and homeopaths are good clinicians first and foremost, which helps them identify illnesses, perhaps understand what is an acute emergency, what is not, and direct the patient, advise the patient accordingly.
Are other countries also adopting it at this? Because I know in India it's very famous.
Yes.
A lot of people have been using it.
Yes.
But what about countries like the US, where pharma is such a big business?
Yeah.
Everything is based on antibiotics and other drugs. How does it
Yeah.
work in the Western world?
So again, by popularity as well as amongst patients and in terms of numbers of practitioners, India is way ahead. But the WHO actually came out and said that homeopathy is the second most popular system of medicine in the world because of its global outreach. So a lot of the other complementary systems have indigenous roots and they are concentrated very much around their countries of origin. While, of course, that's changing also for some systems. But homeopathy is more global. It has come from somewhere, it's popular somewhere else right now. But 100 million people in the EU, for example, use homeopathy.
Wow.
It's part of the healthcare systems in some countries. People have voted it back into their systems in, for example, cantons in Switzerland, Mexico, Brazil. These are countries where homeopathic systems, medicines are part of the healthcare systems. In Germany, for example, you often, patients don't even realize that they've been advised something homeopathic
Wow.
by their conventional doctors. So there are pockets, even in the US, where it is hugely popular. Also, because of the the global immigration and how closely knit now the world is, when you have people originating somewhere else and going somewhere else for work, they still look for things that they're used to accessing. So
Yeah.
you have these huge expat populations in these developed countries who still look out for homeopathy and want to find a good homeopath. They need their medicines. So it's quite popular, and it's steadily growing and continuing to grow in popularity across the world.
Because I assume when you go to, especially in India, if you go to a government hospital, you're not never getting prescribed homeopathy. You're almost always getting allopathy from the doctors there, right? Or is that not the case?
So if you are going to an allopathic hospital, you very likely will be given an allopathic prescription. A lot of hospitals in the country, both government and private, actually have homeopathy departments.
Okay.
And even some of the leading private hospitals in this city, New Delhi, have homeopathy departments, and they often reach out to the homeopath colleagues when they
Okay.
know that the patient may not improve in their system, or sometimes the patient's wish. And so, while it's not most very common, but it is there.
Because I remember being a kid and eating these really nice sugar balls, and
Yes.
it was like, it was medicine time, but I actually looked forward to it.
Yes.
So how is it that this medicine tastes so good and is so effective?
Right. So the medicine is actually not the sugar balls. It's
Yeah.
the liquid that's poured onto the sugar balls, and then it gets absorbed. So the overbearing flavor is sweet, which is something that's very appealing to most of us. But the medicinal substance is the liquid that's mixed with the. Of course, if you're a diabetic, then we can just give you the liquid
Okay.
and not give you the sugar balls. So the medicinal agent is actually the liquid, which contains the therapeutic.
And you mentioned that these liquids are reductions of herbs that they use, correct? And how do you check, in the sense that the patient is responding to it positively, or is there a diagnosis, for example, that these are the medicines that can suit the patient versus not suiting the patient?
So first of all, it's not just herbs; they're also chemicals
Okay.
and compounds, metals, elements, etc. So it's a mixture. The vast majority are herbs, but there's also other common elements and minerals that we use.
Yeah.
How do we check whether? So it depends on what illness one is managing, one is treating. If you're looking for assessment of treatment, it would be very similar to how you would assess any treatment. If you're checking, say, for example, someone has thyroid problems, so you would ask for blood reports where thyroid is assessed. If you're looking at blood sugar, if you're looking at fever, you would have all of these. So they're very objective outcomes that can be used to measure many illnesses. There are also subjective outcomes like headache, for example. So, but the patient is usually able to tell you if you ask the right questions, exactly what is going on as a result of the medicines. There is almost zero probability of anything going wrong as a result of the medication. What may happen is that you are hoping to change the trajectory of illness with your medicines, and that's not happening, in which case you may have to revise your prescription, which is again true of any system of medicine. But that there's really no worry of an adverse reaction as a result of purely homeopathic interventions.
There's a big controversy around the fact that, there's steroids and homeopathy uses steroids. Is that true at all, or?
Absolutely untrue. It's actually illegal for a person who has a license to practice homeopathy to prescribe steroids. There were instances of perhaps people doing this to try and effect a quicker cure or for whatever reason. And this is true across some alternative medicines. I think Ayurveda has also had some issues with this.
Okay.
But it is absolutely not true that there are steroids in homeopathy and that's okay. That's not okay. That's not legal. So no one should worry that homeopathic medicines are have steroids. Also, I think one of the reasons why something like this has been kept alive is when you see these immediate cures or very quick relief in a patient. Allopathic practitioners or anyone else looking at that patient may think that, oh, if it's working so quickly, it can't possibly be homeopathy, so it must be some steroids mixed with it, which is a perception bias more than a factual issue.
Okay. And do you collaborate with hospitals, allopathic doctors, and work together, or is it a completely different practice that if you're doing homeopathy, you cannot have allopathy with it?
No, that's not true at all. You can absolutely have allopathic medicines along with homeopathy. We do collaborate in a very informal manner.
Yeah.
We don't have any official associations with hospitals, but we regularly visit hospitals. We regularly visit intensive care units. Patients are often told about us by the treating doctors at hospitals. Doctors are referring patients to our clinics. These are very well informed people who understand the scope and limitation of their system of medicine, and they are prioritizing the health of the patient over loyalty to an ideology perhaps. So which is, I think, what all of us should keep in mind.
Yes. So, allopathy, of course, is everyone's go to. The minute you get sick, whether it's a fever or from the smallest thing to a fever to a bigger, infection, disease, anything.
Yeah.
Because perhaps, of course, it's so widely accepted,
Yeah.
and also it's the result is much quicker,
Right.
right? Is that true? Or if a person wants to use homeopathy,
Yeah.
firstly, how much time does it take for it to actually kick in
Yeah.
compared to allopathy?
Right. So that answer would depend on what illness we are looking at. And there are reasons why this perception of a slow acting
Yeah.
mode of action is associated with homeopathy. If you're looking at a high fever, it is quick acting. You can't
Okay.
say someone who has 104 degrees Fahrenheit fever that 10 days later you'll be okay.
Yeah.
Right? Or if you have a migraine, you cannot ask a person to wait 4 days for relief. That's not, and that is not asked of by our patients either. So it is quick acting depending on what illness we are treating. But if you're looking at, say, a skin disease that's incurable, under conventional systems, and you're managing it, or maybe even putting the patient into long-term remission, if that takes even 5 years, that's actually shorter than the lifespan of the patient, which was the time span that he would have been on medication had he been on conventional medicine. So it's actually still shorter,
Yeah.
but it may appear to take longer. So, and this is probably the reason why homeopathy is considered slow acting, because it treats illnesses that have almost no recourse in any other system, and it may take time to treat those illnesses. But in acute illnesses, when you have a runny nose also, it can't take 15 days to fix that. So those are areas where homeopathy actually works in a very short span of time. Epileptic fits, for
Okay.
example. So that is a myth in terms of that homeopathy can only act very slowly. The mode of action might be very different also. So sometimes people expect that if I've popped a pill, my body temperature should come down by 4 degrees in the next 20 minutes. That may not happen. But we are not looking at surrogate outcomes where we are just looking at getting less stressed by looking at a normal temperature on a thermometer, but we're looking at getting the patient well. So you may be getting that fever for 7 days because you're suppressing it every 4 hours by popping a pill, but you may get better in 3 days with homeopathy, but not in the first 20 minutes. So you are actually getting better quicker in some cases, but not looking at that brushing under the carpet kind of management of your illness.
Yeah. Because I remember when I was a kid, anything that would happen, my mom would always give me homeopathy. There was no question of me having anything else because she was dead against popping pills. In her head, she obviously felt like there's so many side effects, and homeopathy does not have side effects, according to my mother, at all. But is that true?
Yeah, she's actually she's right. There are no. That's one of the reasons why people often come to homeopathy, and that's one of the reasons why I think parents feel safe giving it to really young children. Is that whatever happens, nothing bad will happen as a result of the medication. And if you take that to the other extreme of suffering, in the sense that if you look at, say, advanced stage cancers, where let's say the oncologist are also not wanting to do anything for the patient. Why? Because there is very little that will be done with interventions of like chemotherapy, but more harm can actually come to the patient, while the outcome may not change. So in palliation, homeopathy has a huge role to play, where you are trying to slow down the illness, but even if that's not happening, you're safely making the patient comfortable without worrying about managing very bad adverse reactions to treatment. So it's like this weird two extremes where homeopathy has a very important role to play.
But which life-threatening diseases, like a cancer, for example,
Yeah.
which other diseases or which diseases can homeopathy actually cure without the help of allopathy?
Right. So I try to be very careful when I make statements like this, because it's very easy to mislead people. So there are people who will say that cancer is treated by XYZ intervention. First of all, cancer is not a illness. Cancer is a whole category of illnesses. You could build a very successful practice thinking that you're managing cancers, but there may be cancers that don't really go anywhere, do anything to anyone, and you could have really nice 5-year survival milestones and things which are very important in cancer. But we believe, especially through our practice, that homeopathy has a role to play even in these serious illnesses. Cancer is one of them, and some cancers we've actually shown in our practice that survival rates are similar to conventional treatment, patients who are on conventional treatment. Also, what's interesting is that we get about 70% of people with advanced cancers because they have not responded to conventional treatment. The tendency may be initially to go to conventional systems when something like this, like a diagnosis like this, is made. But you may think about alternatives only when you kind of run to the end of the road
Yeah.
through conventions. So in that in that subgroup of patients, if even a small percentage is showing similar survival graphs or better in some cancers, I think that's a very, very big thing. And of course, the aggressive ones are difficult to manage, as it is for all systems. Other than cancers, we also look at things like organ failures and things. We conducted an analysis of our own patients where we found that kidney failure patients are reporting about 55% were able to report an improvement in their readings, which is just simply not supposed to happen in the conventional understanding of the illness. So there are these areas that really need a lot more research, but we are seeing very, very good response and in a very safe manner.
Is there a lot of research behind homeopathy that is continuing to happen like it is for other medicines?
Yeah, so there's a very, very active body of research where it's continuously being contributed to by researchers from all over the world.
Okay.
In India, we have the Central Council for Research in Homeopathy, which is it is a central government body, and it's in charge of allocating funding and analyzing, and it comes out with its own publication. There are pure homeopathic journals which publish very high quality peer reviewed papers as well. But I will say this, that when compared to conventional system of medicine, we are lagging behind. There is a lot more that needs to be done at various aspects of the homeopathic system. But it's untrue to say that there is no research.
But is that because obviously there's a big domination of the pharma companies and they, contribute to so much more revenue in because I feel like homeopathy is, at least from my experience, has been much cheaper than going to any taking any other medicines. It's a much more reasonable option.
Yeah. So we believe that one of the reasons why certain perceptions about homeopathy continue to persist is perhaps there is vested interest in keeping it so. There are some examples even in research where very sketchy kinds of research were published in very high profile journals to try and reach a conclusion that was perhaps planned ahead. So there is that. Also, homeopathic pharma itself is not very incentivized to conduct a lot of research. A lot of homeopathic medicines are available generically. So someone put in millions of dollars conducting a piece of research and then not derive any benefit out of it can only be done to a certain degree.
Yeah.
The altruistic nature of research can only go so far.
Correct.
And that's one of the reasons. I feel there's also bottlenecks created for dissemination of research. So I have interacted with people who cover health at really big news publications and who have asked me this question: is there any research in homeopathy? For someone to be in this field, to be covering this field, and to have to ask that question is indicative of how deep these biases run, even without us realizing it.
Yeah.
And there are high-profile peer-reviewed journals that will just flat out refuse to publish research that's related to homeopathy, and that has a positive conclusion for homeopathy. There are news agencies and publications that have editorial guidelines not to cover homeopathy in a positive light. So there are these bottlenecks created, and then even if you do conduct research which is not incentivized and which will not be published in a high-profile journal, no one will carry that news to the public, or very few people will. So while there's still, having said this, there's still a lot of research coming out, but these are some of the reasons why it's not as much as it should. And also, I would like to take responsibility in the sense that homeopaths are to blame, excuse me, in terms of having a certain level of complacence about conducting research, about actively being able to refute or having the skills to refute research that's out there that's either bogus or has flaws in it and things like that. And we really need to work on that. And we are, I feel, as a community of homeopaths all over the world, we're realizing that you can't hide behind, say, texts that were written 200 years ago, for example.
Yeah, because I think even doctors who practice conventional medicine
Yeah.
are much more decorated than the ones who don't.
Right.
They're much, I guess they're much more celebrated And it's just one of those things where every time there's any kind of emergency, people always turn to a hospital that is going to give you allopathy as a treatment and
Right.
nothing else.
Right.
What in terms of skin, I know I again, I know so many people who've suffered from problems, skin related problems.
Yeah.
Is that is a place where homeopathy is very, very effective, right?
Right. So it's also a place where conventional medicine kind of has a very, like I said, a suppressive, brushing under the carpet kind of treatment. So whenever that is the case, then you look at alternatives more. But yes, it is garnered and rightfully garnered a very good reputation in managing a lot of skin issues, particularly stuff that's very recurrent and has a cyclic nature. So in conventional medicine, where you would look at just suppressing the flare up and then waiting for the next flare up,
Yeah.
that's where those are the illnesses where homeopathy often has, where you're kind of trying to break that cycle, and people quickly get frustrated that
Yes.
every winter I have to do this for 3 months, or every 2 months this flares up, then I have to do this, and I'm now developing side effects, but there's no end in sight in terms of my skin getting better, but I'm now starting to worry about my liver. So those are the areas where homeopathy comes in. But allergies in general, so even breathing issues, allergies of the nose, of the sinuses, of the lungs, these recurrent episodic cyclic illnesses, when someone starts looking at a more permanent resolution, homeopathy has a very important role to play. Also, let's say that we are not curing everything that comes through our doors. Just being on homeopathy itself, even if it's not a permanent cure, is still a better deal for a patient than having to take anti-inflammatories or steroids or anti-allergies and things.
Because and then things like, for example, a lot of teenagers especially suffer from acne.
Yeah.
And then as we get older, we have hair fall.
Yes.
How does homeopathy work for these?
So acne again is a condition that has several reasons. Most commonly, of course, is the hypersensitivity of the skin to the hormonal changes in the adolescence age,
Correct.
where there's a surge of hormones, and the skin is not yet ready for that sudden surge, and it reacts. Of course, there are various other reasons. Even in adulthood, one can develop it for other hormonal
Yeah.
issues. So homeopathy tries to bring down that hypersensitivity, that inflammatory, which is actually how even conventional medicine tries to do it. And there are other issues where there's burning, there's secondary infection sometimes of the acne. There's scars that often,
Yes.
even if you go through a phase of acne, you have scars that last for very long, and people are quite concerned. So homeopathy can help in helping, managing those issues as well.
Things like anxiety, depression, there's so many young people on antidepressants.
Yeah.
Has homeopathy made a lot of headway in that area?
Right. So this is very interesting. It's almost ironic because when homeopathy was discovered, homeopaths were the first physicians to understand the mental state as an important clinical area.
Okay.
This is 1796. This is a time when if you had hysteria, you would be made to drain some blood, because that it would mean that you have excess blood. That was the allopathic
The
way of managing it.
diagnosis, yeah.
Right. So homeopaths, and Dr. Hahnemann being the first, understood that the mental state is actually very important and has to be looked at separately from the physical state, while they also obviously have a huge overlap and a cause and effect. Psychosomatic connections, these were first discovered by homeopaths and homeopathy, even before psychiatry was considered a specialization. So
Okay.
we have had this head start in mental health issues, and even today. So there was a paper that actually compared some homeopathic medicines for depression to conventional antidepressants, and there was comparable outcomes. So it's something that we work with a lot, and it's very, very efficacious. People who've been on conventional antidepressants may need a very slow weaning, because it's not always advisable to suddenly withdraw these
Yes.
medicines. But there's a lot of scope for people to benefit who are suffering from mental health illnesses in homeopathy.
Because this is also the placebo effect, right? Where is that a thing? Do they think it is a placebo? Because it's so effective in so many ways, but people still think it's this.
Yeah. So again, one has to go into what the placebo effect is and why it's associated with homeopathy. One of the reasons is the consultative process. When you sit down with a homeopath, generally speaking, you would spend an hour or more talking about every aspect of your life. That has a cathartic effect.
Wow.
And patients start feeling better. So this was what was used to say that actually the medicine is not doing anything, is the consultation process that actually helped the patient. But the argument that we make is, first of all, that's not how homeopathy is practiced in many parts of the world. Our practice, for example, I hesitate to say this, but it's not a very pleasant experience coming to our clinic. Huge hours of waiting. We are able to give very little time sometimes to a patient. And overall, it's not a very pleasant experience because of how busy it is. We
Yes.
don't have an hour with a patient, but these patients are improving. Just by talking, is your wart going to fall off your face? If it is, then maybe conventional medicine needs to really look at what they're doing, right? And also very objective measures. Like I said, if blood sugar is going to start falling, if thyroid is going to normalize, then conventional medicine really needs to look at what it's doing for these illnesses. If they should just chat with their patients, number
Correct.
one. Number two, look at the consultation process in busy clinics, in
Yeah.
India particularly. And this is true again in all systems where doctors are really overburdened and everyone's going through it. Yet it seems to work. Then look at some very particular patient groups. An infant. How is his fever coming down? What is the placebo effect in a person, in a living being who is not able to communicate with you or perceive what's being done to it? In animals, how are inflammations, fever, infections going in an animal where you have very limited means of communication? How is the placebo effect coming in to an animal? So it doesn't really look at the subject in any depth. I think a phrase like, "Oh, it's placebo effect," but I understand where it origins, the origins of that idea in terms of the ultra dilution argument, etc.
So when you prescribe some medication to your patient, how often do you after that communicate with them? Because this is again, I've at least in my experience again with doctors who've just given me any kind of medication, allopathy. That's it, and there's nothing. There's no how are you. I understand, of course, they're very busy, but I'm saying overall,
Yeah.
there is zero feedback. Is that the same case with homeopathy?
So I would think that there are different styles of practicing. I think in conventional medicine as well as in homeopathy, it's not, there has to be feedback. If of course the option is, if you're suffering from an acute illness and it goes away, you don't need to come to the doctor to say
Correct.
thank you. But if it's something that is going to come and go, and depending on how you're staying, I need to hear about it. I need to know it. We always give the patient that if you're doing really well, you can continue the medicine for a little while and then come. But if you're not doing really well, try and meet with one of us,
Yeah.
uh, perhaps earlier than later. So we need that feedback. We need to study, say, blood work down the road. If I'm giving something for cholesterol, I need to see how that is doing. Maybe in 6 months, but I do need to see that.
If someone comes to you with like a grave illness, right, that this is a matter of life and death, what do you of course depending on what it is, but
Right.
do you sometimes prefer them going to a conventional doctor and focusing on allopathy, or do you still try to treat them through homeopathy?
Right. So it's one thing that we are very clear in our practice, because we do see a lot of critically ill patients by whatever reason in terms of popularity of these illnesses at our practice. We're very clear that the welfare of the patient is something that trumps everything else. It, just like I would say that conventional medicine, we don't have to necessarily be true to an ideology. That applies to us as well. We are not here to promote homeopathy in the minds of families and patients who are critically unwell, or even perhaps prey on the vulnerability of a patient in that in freedom of mind, in that very
Yeah.
desperate situation. So keeping the patient well or trying to get them well is the only goal. Often there are lowering of expectation kind of conversations that we have to have, that this is a fairly advanced disease. We don't know how much we'll be able to help you. We may try and arrest it, only not look at progression, but not look at reversal either. These are conversations that we have to have, and it's not a zero sum game. It doesn't have to be me or them. It's always for us at least, it's always a collaborative approach wherever it's possible, and prioritizing the welfare of the patient over literally anything else.
And I think this is where people also perhaps don't know whether they should choose homeopathy or allopathy. How
Right.
can they make those decisions better? Because from what I understand, homeopathy has no side effects. But
Right.
allopathy, the minute, for example, I break into hives all the time, and then the
Right.
minute I get it, I'm just like, I'm just gonna pop an Allegra. I'm not even thinking because
Right.
I want to get okay instantly.
Right.
But then that Allegra I'm having for 15, 20 days in a row
Right.
sometimes, which is,
Right.
of course, damaging my kidneys and my liver.
Yeah.
Uh, how does one make an informed decision and have that patience while making that decision?
Right. So one has to meet with a homeopath and have a conversation. A good homeopath will give you a very balanced view. That's one. So whenever you're looking at a condition that is recurring, and you're seeing that I'm getting only temporary relief, with one should look at homeopathy. Also, you will find that you may have seen it in your case, and we see it in patients, that the requirement of that temporary reliever is also going up. So what I would pop in, say, once in a month, now I'm doing 3 times in a month or
Correct.
4 times in a month. Then that is not helpful. I need to pop something stronger at a higher rate. So when the risk of side effects was 1x, now I'm at 3x risk of side effects. Plus, I'm not any better with my illness. There's a researcher doctor called Victor Montori, who actually pioneered the patient-led decision-making process, where you actually go to the patient and ask them, like, this is a risk to your liver, for example, this medicine. Would you like me to still take it, prescribe it for you, or would you like something else that may be less effective for your allergies, but is better for your liver, for example? So always going to the patient and seeing what that patient would want is very important to bring into the conversation, which I feel is often not the case in a consultation with a doctor.
That's very interesting, and I think you're so right about allowing them to think about what decision they want to make based on the side effects. My grandmom has rheumatoid, and she's been on homeopathy forever, and I think she swears by it. So, for elders who already are perhaps have damaged their livers through other medication or don't want to damage their livers at a certain age, um, is homeopathy quite good for joints and other like muscle related issues eventually that people develop?
Yes. So rheumatoid arthritis is, of course, can be pretty aggressive in patients, and it's an inflammatory and degenerative process. And when you factor age into that, where there's a natural process of degeneration just by virtue of aging, and you have this, it can be quite debilitating for the patient. But homeopathy is able to help a lot of patients with RA, with rheumatoid arthritis. If you've been on conventional medicines for a while, there is again has to be a slow weaning, often in consultation with your rheumatologist, who will notice improvements and will be open to reduction of your allopathic medicines gradually. There are, of course, these concerns where, having taken allopathic medicines, we have developed side effects, and overnight our doctor decides that I can't give you this anymore, which is, of course, not an ideal situation, but we get a lot of these patients who are saying, now I'm back to really bad pains and aches, and I can't take the medicine that I've been taking for so many years. Again, something that homeopathy can manage, but it's always better to do it in a more controlled manner. But yes, so even cervical spondylosis, thanks to work from home and digital device
I
abuse.
am the I need that for sure.
Right. So we're seeing a lot of that, particularly through COVID and beyond. And lumbar spondylosis, where you have lower back pain, slip discs. These are very, very common conditions, often surgical sometimes.
Yes.
But patients respond really well to
Okay.
homeopathic management.
That's incredible. I think these are the things that people really, if homeopathy can cure it,
Yeah.
then we were perpetually getting, of course, physiotherapy, there's workout, etc. But in terms of medication for pain,
Yeah.
we get so used to living with pain,
Yeah.
in our neck, shoulder, that's become
Right.
part of our lives.
Right.
So
Right.
you're saying homeopathy can really help
Yeah.
with.
Right. And also, this is again part of the advice that we give to patients. One has to look at why these things are happening to us, and one really has to correct those. If it's posture, if it's lack of physical activity, if it's excessive usage of devices, these are things that we really need to correct, because let's say we've taken medicines for 3 months
Yeah.
and we are absolutely okay. We are not going to reap the benefits of that 3 month of medication for the rest of our lives.
course.
Right? So one has to really correct those to stop having to come back even to a homeopath.
I think also one of the things that they say when you're doing allopathy is that you get immune to it and your body stops responding to the same medication. At least that's what people talk about sometimes. Is that the same case in homeopathy that if you've been having it long enough, your body is just used to it and it's no longer responding?
No, that's not true. Many medicines actually have to be taken for very long because of the nature of the illness, etc. And it's usually okay. But there is a need sometimes for course correction. Patient can just not respond to the same set of medicines, not because of how long he's been on it, but because the nature of the illness has changed or something else has come in, etc. But there is no danger of running out of efficacy just because you've been on something for a while.
I remember when I was a kid, there was a doctor in Sundarnagar. His name was Dr. Advani. He used to be my homeopathy doctor, and every time we would go, my mom, whenever she would give me the medicine, I was not allowed to have anything to eat 15 minutes before and 15 minutes after
Okay.
the homeopathy medicine. Is
Yes.
that
Yes, that is still the case.
Okay.
Depending on who you speak to, it could be 20 minutes or 30
Yeah.
minutes. But yeah, we generally like the efficacy of medicines goes up if there's no flavor in your mouth when you're consuming it. So that's one reason why that
Okay.
gap is encouraged.
What about nutrition when you're having homeopathy in terms of your food, alcohol? People drink. So many
Yeah.
times when they're having antibiotics,
Yeah.
certain types of antibiotics, they're recommended not to drink alcohol,
Yeah.
even if it's just a mild, infection.
Right.
But with homeopathies, how important is the nutrition and lifestyle management part?
Right. Just for the efficacy of homeopathic medicines, there's a very short list of restrictions.
Okay.
We generally say that excessively sour things,
Okay.
like Indian pickle and things like that, to be limited. Not necessarily totally avoided, but not with every meal. Raw onions and things like raw garlic and stuff are to be limited, again because of the strong flavor that lingers can affect efficacy. Cooked stuff is fine. So this is the stuff that's very specific to homeopathic medicines. The rest of the advice may be related more to the illness that we are managing rather than the medication. And of course, alcohol and things, if this in excess, can affect general immunity in the body and how the body may react to a disease, etc. But it's not a not a complete ban when you're on homeopathic medicines.
Okay. How does homeopathy, if you can tell me a little bit more about how you compare it to Ayurveda, because a lot of people are turning towards Ayurveda. There are hospitals opening, people are really opening their mind to new things, to try new things. How would you compare homeopathy and Ayurveda?
So the fundamental difference in my limited understanding is that Ayurveda would use the crude herbs and minerals and metals sometimes, whereas homeopathy would dilute them. So there is no crude element in our medicines. That's one. We also believe that the indications are completely different. So let's say there's an herb that's used in homeopathy and it's used in Ayurveda. What we use them for might be very, very different.
Okay.
So, and of course, the origin is completely different. We know this. Homeopathy is from Germany. Ayurveda, of course, originated in India and many, many thousands of years ago, as compared to homeopathy. Homeopathy is, in that sense, a modern system of medicine because it's newer than conventional medicine, also, and it was born out of, like I said, dissatisfaction with the current practices of the time.
Yeah. There's homeopathy made in Germany and India, right?
Yes, and of course, in many other
Countries.
countries
But
as well.
which one is more, which one do you recommend usually?
We don't actually necessarily recommend that you should get them the
Okay.
German made because
It's-
very good, like these standardized good manufacturing practices have been enforced in pharmaceutical units all over the country, and we're reasonably confident of the quality of most available homeopathic medicines.
What about, I know this is a really, I just randomly thought of this because I remember when I had COVID, I was given steroids and then suddenly I broke into this really bad rash all over my body. Could homeopathy have helped then in a big way during the COVID-19?
Yes. So, in fact, I've written about this quite a bit. The COVID-19 pandemic actually shone a light on how important homeopaths and complementary practitioners are to this country, what a critical role they played at a time when medical practitioners were so difficult to come by
Yeah.
in general, and how valuable that was as a service to society in that phase. But yes, and we managed a lot of COVID-19 cases. We had patients in ICUs who were also, well, people were giving up on them and who were seeking homeopathic medication. So COVID was a seminal point in our memory where homeopathy actually rose to the challenge. And
Wow.
was also it's important to understand that at the cutting edge of what's happening, homeopathy had a role to play, both at the prophylactic level as well as really complicated severe COVID-19 patient level. It's very important what homeopaths and alternative practitioners did for patients at that time.
Could also homeopathy have been one of the perhaps reasons to avoid getting the vaccine? Because now I know so many people have had side effects from the vaccine.
Yeah.
Would that could that have been a possibility or?
So this is a lot of it is wisdom in hindsight. So I don't begrudge decisions that were taken at that time in those circumstances.
Sure.
We had to do with the evidence that we had. That was
Correct.
the best evidence for the time. We've come to understand that the vaccine has had a very good role for
Of course.
for patients, and perhaps was instrumental in breaking the cycle of the pandemic at a point. But again, as time has gone forward, we've realized that there is this variation, and we need to really look at the strains that it protects against. There's a need for boosters of COVID. So the value of the vaccine perhaps has now come down a little
Yeah.
bit. But at that time, before the vaccines were out, there was advice both from the Central Council of Homeopathy for a prophylactic medication that came out of the government's departments, and we had a protocol that we let known to the public as well, and we saw very very effective protective effect. But I would say that at that time, perhaps because there was so little to go on, the vaccine was welcome to save lives and provide, especially to the vulnerable
Of
population.
course. What about homeopathy with animals? Do a lot of animals get treated through homeopathy?
Yes, actually, and it's again one of those reasons I think why people come to homeopathy in general, where they want to give medicines that are free of side effects to um, their pets and almost members of their family in a sense. So yes, so we do see quite a lot. There are people I know of homeopaths I think whose practices are almost entirely related to animals.
Wow.
And there's a lot of research out there. Uh, the royal family a few years ago came into focus because they were treating a lot of homeopathy to treat their pets and their farm animals, and they had very good results in those. There's research papers out there on mastitis in cows and various other conditions. At our clinic, we often have pets for which people seek advice.
So they're allowed to come to your clinic?
They are. We meet them outside
Okay.
as a mark of respect to other patients who may be
Yes.
suffering from something that might harm or be harmed. But yeah, we do see patients who are animals at our
Because
clinic.
I like I mentioned, I have a Dalmatian. He has an autoimmune disorder,
Yes.
and he's been suffering with that. Plus, the medication is making him just,
Yeah.
lethargic. Obviously, his digestive system has taken a toll.
Yeah.
What can homeopathy really help him get better? But also, if I start giving him homeopathy, can he be weaned off his medicine, or is that not a possibility?
No, it is definitely a possibility. We draw a lot from our experience in human patients when we treat
Okay.
animals as well, and that's really held us in good stead in so many decades. And of course, now we have some experience in just managing animals exclusively
Yeah.
because of the experience that we have garnered. So, by that logic, we see a lot of people who have been weaned off allopathic medicine in autoimmune conditions. There may be a point where there are patients, of course, who are not entirely weaned off, but they may be at say 50% of their
Wow.
medication, or go through long periods of no conventional medicines as well, which are all hugely beneficial to the overall state of health of the patient.
I met a friend, who was telling me that you treated her just before she got married. She had an autoimmune condition, and then you treated her. So
Okay.
I was very excited to talk to you about that. Would
Right.
you like to give some examples of cases where people have just left allopathy and after having severe conditions, taken homeopathy and recovered?
Right. So there are quite a few.
But anyone really successful?
Um, there's a cancer case that comes to mind, who was diagnosed very advanced cancer, and she was asked to basically go home and call all her relatives and say her goodbyes, um, and she was given weeks to live, and she's been she's not disease free, she's still suffering, but she's now in our 4th year of treatment with us.
Wow.
And now there's talk of restarting chemotherapy and things, because the oncologists are wondering that, okay, if you've survived this long, might as well give it another shot. So that really springs to mind. There's also someone that we helped who was a fruit seller and who had diabetes, and he developed diabetic foot, which means a gangrenous, pre-gangrenous condition, which would lead to amputation, essentially, if it was unmanaged. And that was what was being suggested to him. But that would mean that he would no longer be able to work and earn a livelihood for himself and his family. And we were able to save him from that. And just the impact that that would have had on his life and how he avoided it, these kind of patient interactions stay with you.
What about data in homeopathy? How is this AI? Everyone's talking about that in medicine. How are you using AI in homeopathy, or are you using it at all?
Early days, I think, for AI in general,
Yeah.
and also for us, but it is very interesting. I think the world of just the practice of medicine will benefit greatly. It has made slow kind of inroads already. The diagnostic bits,
Yes.
for example, comparing an MRI film to a library of, say, 60,000 MRIs of the exact same part of the body, will just increase the accuracy phenomenally.
Yeah.
A stethoscope which has not undergone any significant advancement since its invention will suddenly be used to match the sound clippings of the beating of someone's heart to a library of all, say, congenital heart anomalies. And you may be able to get at least a hint of what the illness may be, and not have to, first of all, not miss it entirely, and not have to, say, advise an echocardiogram or something else. So those are benefits that I think all clinicians, including homeopaths, will derive. The other interesting bit about AI is, because homeopaths are essentially general practitioners, so they're looking at everything from the head
Yeah.
to toe. So the pattern matching becomes more difficult. And when you have AI working for you, or if you're able to feed it huge amounts of clinical data, say we have, say, 15 million prescriptions at our practice. If you were to feed that in, the patterns that an AI agent or a piece of software will be able to come up with may actually give us very good insights
Absolutely.
into what has helped, what has not helped, what we think is helping but actually is not helping. All of that is very exciting, and I'm very excited to see how that can be leveraged
Yeah,
at our
that's
practice.
amazing. How do you see the future of homeopathy in India and globally?
Right. So the popularity of homeopathy is growing phenomenally, has steadily grown, and I think there's been a kind of a booster dose to that popularity with COVID. There's been greater understanding of, say, side effects of allopathic medicines. People want things that are gentler on the body.
Yeah.
They're valuing overall health rather than any specific
Correct.
suppression temporarily. So that's there. There's very good data to show that popularity. We know that the central government health services, 1 in 5 patients are asking for homeopathy.
Wow.
And they may actually feel the need to take allopathy because homeopathy is not available at that center, because only
Wow.
1 in 19 centers actually have homeopathic units in that particular CGHS framework. So we know that it's actually already being underserved in this country. There are perception issues that perhaps is slowing down popularity, but despite that, it's growing with huge bounds. There is a greater need to adopt research practices and understanding research methodology amongst all clinicians, I feel, but most importantly homeopaths, because we don't have as big a base of evidence as other systems. That those two bits are, I think, important in the continuing evolution of homeopathy.
And what are the professional opportunities for homeopaths now?
Right. So, of course, clinical practice is a very, very big area, and many of us, I think, enter any field of medicine envisioning that role. And there's huge scope. One can, of course, open up one's own practice, join a very busy practice, join homeopathic divisions in big hospitals, become medical officers in corporates, look at anything that requires clinical or medical skills in any corporate setup. So there are medical officers needed in, say, NGOs, for example, in insurance agencies and insurance companies where claims are analyzed. A lot of people have the training of in medicine through homeopathy and then can go on to careers along those paths. They can get into managerial positions where you can be in hospitals with your clinical training, but also rise the corporate ladder through management areas. Research is a very important area. One can become an academician or a researcher through government bodies or other research wings of pharma bodies. So there are various opportunities open to potential homeopaths.
So, there's no scientific basis to homeopathy. Can you please elaborate on that and tell me a little bit about that?
Right. So that the statement as it is, where people say that there's no scientific basis to homeopathy, is usually, I find, an emotional statement rather than a statement from a position of being well informed. There are various components to answering that. One is like we should take ownership of the fact that there is less evidence than we would like, and that's because of many reasons. One is the complacence of homeopaths. For a very long time, there were homeopaths who were not interested in conventional research practices, saying that individualized treatment, like homeopathy does for many in many practices, is not amenable to a randomized controlled trial setup, for example. Which is, of course, there are various ways where, for example, we practice clinical homeopathy, which is very amenable to a trial design. So practices have evolved because replication of results is important. Also, I've already talked about how pharma companies are not incentivized to conduct research, and the bottlenecking of the dissemination of research. There's one most concerning bit about this is the biases that are there in throttling research, where journals refuse to carry any research related to homeopathy except if it's negative. One of the seminal papers that came out that was thought to be the coffin in the nail in the coffin of homeopathy was published in the Lancet, which is a very, very influential journal. After it came out, a critique of that paper was that very suspicious inclusion criteria was used, so that one particular study could be included, which would then sway the results in a particular direction. Had that not been included, the results would have actually been in favor of homeopathy.
Wow.
So, of course, there are various ways of conducting research, but this speaks to the bias that is there and the objective that is fixed before the research is even conducted. That's a little unfair. Another thing that came to light was the National Health and Medical Research Commission in Australia came out with a systematic review that said that homeopathy is not effective for any illness. Once it created a furor and things like that, but there were people who were aware of the fact that there was actually a review that was conducted before this one came to light by a lead author, researcher who has actually contributed to various reviews for the same committee and has been instrumental in health policy decisions for the Australian government. But that review was suppressed. The results of that review showed that homeopathy was actually effective for 5 illnesses that they had reviewed. But the results were suppressed and a new review was ordered, and the one that was given to the public was the one that showed that homeopathy doesn't work. Again, there can be arguments about the quality of reviews and things, but the level of interest in suppressing anything positive, even at a policy level, to the point where reviews are redone, speaks to the efforts that are dedicated to help this perception against homeopathy live. And that's a little scary and it's a little unfair.
It's very interesting because, I think so many of the kids, for example, just just talking about, like thinking about what you're saying, whether it's ADHD or whether it's dyslexia. So many parents are facing this problem. Is homeopathy very helpful for treating these conditions?
Yes, so ADHD is something that we work a lot with. So, of course, ADHD is a diagnosis
Of
that's used very
course.
loosely.
Yeah.
So, we're talking about clinically diagnosed ADHD.
ADHD, yeah.
Dyslexia, we are able to help a lot with, provide the tools, and along with training and other interventions. Dyslexia may not always be reversible in every case. Often it's misdiagnosed. Often there are transient issues that are resulting in dyslexia. There might be other neurological things that are going on. But yes, these are things that can be managed with homeopathy.
What about insomnia? Treating insomnia, is that a very because I suffer from it,
Yeah.
and usually, I'll just take a melatonin sometimes,
Yeah.
but I think even that has stopped helping me.
Yeah.
Can homeopathy help in
Yes, so insomnia is something that we have, I think, with the urban population is a very, very big issue, probably as a result of really bad work-life balance in some
Yeah.
cases,
Stress.
and bad habits, stress, etc. And it's a very important thing to address for the overall health of patients.
Yeah.
People underestimate the impact that these things can have. Often there's working late is the norm. If you're not working late into the night, you're not doing enough at work. These kinds of things really feed into that lack of sleep, and then it has very real impact, not just on mental health and energy levels, but on things like thyroid, cardiac issues,
Yeah.
various other long-term issues. So it's very important to address, and it's something that we address quite commonly at the practice.
Great. I think this has been a very, very insightful conversation, and at least for me, I'm definitely coming to you for all my all my ailments, and not. And I'm really going to try and have some allopathy because it's been such a habit. It actually turns into a habit. But
Right.
thank you so much for coming and giving us all this information.
Thank you so much for having me.